Dr. Tomi, what is schizophrenia?
Thank you. Schizophrenia can be defined as a chronic mental disorder that affects the way a person thinks, a person feels, a person perceives things, or in which the person sees things in reality. It's more of a problem of distortion with reality. So there's an abnormality in the person's perception. So when we talk about schizophrenia, it's more of the symptoms or the characteristics that characterize what the person is seeing. Like, for example, I mentioned a distortion in reality. Now, what does that mean? That means probably if you are seeing something as white, person with schizophrenia is seeing it in a different way. I'll give you an example.
Okay.
One of the symptomatology that characterizes schizophrenia,
Please slow down the English. What is symptomatology?
Okay, one of the clinical features, what you see in somebody that has schizophrenia is what we call positive symptoms.
Okay.
An example is hallucinations.
Oh.
Now, someone with schizophrenia can start hearing voices of unseen people in clear consciousness without the person beside him hearing it. So hallucination generally is a perception in the absence of a corresponding stimuli. So I'm moving, I'm like, oh, I can hear Sheriff talking to me. But Sheriff is not there. Sheriff is not saying anything. And I'm possibly asking everybody around me that, can't you hear Sheriff talking to me? But nobody is hearing. That's a form of hallucinatory experience.
So it's not that they are actually hearing.
Yes, that's why I said there's a distortion of reality. So what is real is different from what they are perceiving. So that's a characteristic amongst many other characteristics. So one of it could be an hallucinatory experience, so which could be auditory, like I mentioned.
Yes.
You know, you could see, I've seen a client who told me that he was on the Lagos-Ibadan Express Road, and then he heard the voice that he should turn back. And then he reversed back on the expressway and then turned back. I've also experienced an occupational hazard in which a client stood up while speaking with him and he slapped me. And then I was like, what happened?
You.
It was like, the voices told me to slap you. So it's real to them. It's a perception without an abnormality in perception. That's a form of hallucination. Auditory. It could be visual. The person could start seeing strange things other people are not seeing in clear consciousness.
There's something that I know oftentimes happens to a lot of people. That you just hear someone calls out your name. It could be your father, it could be your mother, but the person is not there. But to you, you are so sure that you heard your name being called out. But then you're like, did you just call me? No, I didn't call you. Mommy, did you call me? No, I did not call you. What's that, Dr. Tomi?
Well, it could be at that moment there is a decrease in your perception, and that's why there is a problem of perception, and you feel that, oh, I can hear this voice and it's not there. Sometimes it happens.
Is that a sign?
It's not. No.
It's not a sign.
It must be, you know, when we say hearing this thing, it's consistent.
Okay.
There are other signs alongside
you said for a month,
it.
Okay.
Yes, there are other things that you are asking questions on, trying to rule out, before you say, oh, this thing is this, or else we'll tell everybody and say everybody has this thing. So there are other questions that comes along. It's just like probably maybe you are passing on the road at night and then you see trees. And you feel that, oh, this looks like a snake. Really, there's no snake there, right? And it's not as if you will now start saying, but it's just a problem with perception. As at that moment.
Fantastic.
That's it. So now, schizophrenia, it occurs in both sexes, male, female, almost at a ratio 1:1. Oh. It starts a bit earlier in males than in females. So based on literature, it could start as early as the age of 15 to 25 for males. And then you could start having it around that time to the age of 35 for females. So yes, but it's slightly earlier in males than females. And it could start as early as the age of 15 years of age. Yes, so you could have it. And when we talk about the causes, we could decipher why a child of 15 years could start manifesting symptoms of schizophrenia. Okay. I'll go there now, but let me answer the second question about, is it curable? Yeah. The definition from schizophrenia, like I said, is a chronic mental illness. Now, when something is chronic, we manage it. So we don't say we are curing schizophrenia. We are saying we are managing it. So it's an ongoing management. Just like other chronic illnesses. We talk about hypertension, we talk about diabetes, which are chronic illnesses.
Right.
I know that for majority of people, once they make that diagnosis, they are usually on their medications. You could reduce the dose, you could increase it based on the improvement.
Yeah.
It's also similar to managing schizophrenia. The person is on the drug, but will keep looking and adjusting the dose based on the clinical improvement that we are seeing. And so people need to know that it's something that most of the time they have to be on the medications. And if they are not compliant with the drug use, that's one of the number one reason why the person could have a relapse. So you are like, oh, this person has broken down again. This person is this. It could be due to poor drug compliance. And it could also be to stressful life events that now makes the person break down again and come down with the illness. Quickly delving into the causes to know, especially why a 15-year-old will probably have it.
Exactly.
Now, number one cause that we talk about is genetics. Genetics play a very huge role in the etiology of schizophrenia. If both parents have schizophrenia, for example, the children have a 40% chance of having schizophrenia. If one parent has schizophrenia, the children have about 12% chance of having schizophrenia.
Okay, so it drops.
So if it's one parent. So that shows that the children could always have it.
It's hereditary.
It's hereditary. It has up to 60 to 80% heritability in schizophrenia. So it's hereditary. So genetic malformations, you have some genetic problems too, it could lead to it. We also talk about issues such as obstetric complications. So a child that probably has a birth asphyxia, or those are risk factors now. The birth asphyxia or the maternal infection that was not properly treated. We've seen cases in which that could be the root cause of the child coming down with schizophrenia. There are also problems with different what we call chemicals or neurotransmitters in the brain. You could have dopamine, for example. Studies have shown that there's an elevated form of dopamine. So when we are giving drugs, we are giving drugs to reduce or bring down that dopamine in the brain. So that could also be part of the causes. Again, those that smoke, substance abuse, cannabis use, could lead to a psychotic problem, could lead to schizophrenia. So start smoking marijuana and you are feeling good with yourself that you are getting some benefits. The person could land with schizophrenia in a matter of time.
Shisha uncle, those people that
all
smoke
those
shisha.
things are all those substances. They are all risk factors for coming down with a mental health illness.